Maria Clara?
Okay, thank you very much. I'm very pleased to be here. Like always, we have a very good experience using the rings. And I'm confessed that I was one of the persons that was more afraid to do ablations over patients with keratoconus. But here I am doing it. Now, the purpose of this study is to determine the safety and the efficacy of in patients with early keratoconus undergoing simultaneous LASIK and accelerated cross-linking in patients that already have intracorneal rings. We think that combined corneal cross-linking and surface ablations are a viable option to enhance vision in eyes that were previously treated with intracorneal rings and stabilize the ectasia and improve visual acuity with reducing astigmatism and some symptoms we have with the rings. Okay, how we did it? We did not LASIK extra. We did LASIK. We removed the epithelium, and after doing the treatment with a soaking time of 60 seconds, and with the UV radiation of 75 seconds with the intensity of 30 millivolts. All the patients have at least 1 year of the rings previously. Okay, we have 6 eyes for 5 patients. All were got keratoconus, as I mentioned, at least 1 year treated. And we used ablations with the Schwindamari 750. All were customized ablations. And we use, as I said, accelerated cross-linking with the Avedro system. We have only 3 months follow-up in these patients. And we measure all variables, vision, keratometry, topography, and Chimplon imaging. And we are starting to do the measurements of confocal microscopy in some cases, but I don't have it in this presentation. Okay, for the operation, as I mentioned, we use customized profiles. We do the 6D eye tracker and the cyclotorsion, all the capabilities of the laser. And we have ablations between 13 microns to 74, the maximal. We have residual stromal beds between 312 and 445. We can see from the population with the age was around 25, 34, sorry. We have keratoconus stage 1 and 3, and we have, as I mentioned, 6 eyes of 5 patients. Okay, we can see, this is very interesting, the under-correction visual acuity, it was previous the ring, 0.16. After the ring, we improved to 0.31, and after the treatment with the LASIK extra immediate of 0.78, when it's clear the improvement. The best corrected visual acuity was as well improved from 0.61, 0.75 to 0.84. The sphere was reduced to very minimal numbers, and the most interesting is the cylinder, that we start with 365. We have a patient with very high cylinders, to 192, and we go to minimal level. We can see here the keratometries with the same situation. Now we go from one case. It is a very interesting case. We have a refraction of -5 with -6 with cycloplegia similar refraction with the central pachymetry of 462. We plan 2 rings, 160, 200, 160, 300. We use all the surgeries with the LDV femtosecond. Here is what we plan, the graph of how we have the plan for the surgery. Now, 2 years post the intracorneal rings, we can see our results. We plan a treatment for a corneal wave front with the refraction of -2, -175. The patient already improved the visual acuity, but still need correction, and we target for plano. We did an optical zone of 6, an ablation depth was 59 in this patient, and residual stromal was 345. Now, the results that we have, excellent. Uncorrected visual acuity 0.8, best corrected 1, is sphere 125, cylinder minimal. Improve in all the parameters. We can see 2 years after the ring and after our treatment. This is the differential map of this case. Now we have another case. It's a 20-year-old male, stage 2 of keratoconus, a refraction, less, 2.5 of sphere, 2 of cylinder, with a good visual acuity before the rings. We have only placed 1 inferior ring, And this is what we got after placing the ring. Was it not? We induced astigmatism in this case. We have 325 of astigmatism, but our vision was very good. We planned the same procedure, a corneal weld for treatment, with an extra procedure by removing the epithelial. And we can see here the summary of our result. We start with 0.1. We go after that 0.25 uncorrected, and we are uncorrected in 1. Sphere 2.5, 1.50, and cylinder the same. Improvement in all the parameters. We can have here the case. It's extremely impressive. This is the keratoconus after our ring, and 2 years after the treatment, 3 months result. The differential maps. In conclusion, LASIK and accelerated cross-linking in post-Keraring patients yields excellent results after 3 months. We need to prove the long-term stability to be confirmed that this technique really is worth it, but I believe it's a very good option in patients with previous intracorneal rings. Thank you very much.
Thank you, Maria Clara. Just one question, because you are going to leave. Do you use any special pattern to treat the refractive residual error, optical zone, any key, any secret, wavefront, topography assist, anything?
I already said, in all the patients I use corneal weight for treatments.
Just regular corneal wavefront?
No regular corneal wavefront. It is, okay, regular corneal wavefront, yes. Yes. The one is in the Amaris with the arcade, yes. But the optical zones depends of the patient.
Okay, but is you compare with other one, is it smaller or bigger? You compare with the standard 6 millimeter optical zone. What do you use, more small or big optical zone? In the beginning, I was a little bit worried too, because the rings are there, but you see the ablations are not too much. In this case, when I see that I really need to go deep, I try to reduce the optical zone, because I don't want to be in the area of the rings. But if it's superficial, I don't mind if I'm even working in the top of the rings. Okay, that means it's almost the same that always.
Yes, I'm not going to
tell me the truth,
6.
Tell me.
No, I'm telling you the truth.
Okay, Maria Clara. Very good. Thank you. Thank you very much. Very interesting.